welcome to The Explainer. So today, we are going to uncover the fascinating story behind a natural oral hygiene tool that has survived for over 5 millennia. And it just might be the one thing missing from your morning routine. Let's get right into it.
Can a 5,000-year-old twig actually outperform your modern toothbrush? It's a pretty provocative question, right? But today, we're not just relying on folklore. We're going to dive straight into the hard, modern clinical data to see if ancient wisdom can truly hold its own against 21st century dentistry.
Here's a quick look at our roadmap for today. We'll be covering the ancient chewing stick, its religious significance in Islam, the science of Salvadora persica, clinical and therapeutic benefits, and finally, how the Miswak stacks up against modern toothbrushes.
Starting right off with Section 1, the ancient chewing stick, origins and history. It's wild to think about, but civilizations across the globe actually discovered the power of the chewing stick completely independently. Just look at this timeline. All the way back in 3500 BC, you've got the Babylonians using fiber sticks. Fast forward to the 2nd century BC, and the Greeks are out there recommending blades of straw. And then, in the pre-Islamic era, ancient Arabs were utilizing the roots of the arak tree to keep their teeth bright and maintain ritual purity. And the preparation of these sticks is just brilliantly simple. As you can see, a stick cut from the roots of the arak tree is tapered and then chewed on one end until it literally frays into this natural bristly brush. Historically, users hold it with a pen-like grip to mechanically sweep away debris from their teeth and gums. It's super effective.
Moving on to Section 2, religious significance in Islam, prophetic traditions.
So in Islam, basic oral hygiene isn't just about grooming. It's seamlessly woven into religious jurisprudence and ritual purity. The Prophet Muhammad viewed the Miswak, which is just another term for Miswak, as a literal means of purification for the mouth, and importantly, a source of achieving the pleasure of God.
He was absolutely a fervent supporter of its use. Based on the historical texts, he recommended using the Miswak upon waking up, before going to sleep, right when entering the house, and ideally 5 times a day before prayers. He even stated that he would have made it mandatory if it weren't too difficult for his followers to keep up with.
All right, Section 3, Science of Salvadora persica, Nature's Pharmacy. Let's see what's actually inside this thing. Let's take a look at the botanical profile. The Miswak is mostly derived from the arak tree, known to scientists as Salvadora persica. It's this small, evergreen shrub native to the Middle East, Africa, and Asia. And here's the kicker. Because this rugged desert plant is a total survivor that thrives in extreme, bone-dry, and highly saline environments, it packs an incredibly dense payload of protective chemical compounds.
It literally acts as a natural all-in-one pharmacy. Just check out this breakdown. It dispenses silica, which works as a natural abrasive. It has calcium, chloride, and naturally occurring fluoride to remineralize your enamel and stop plaque from hardening into calculus. Then there's tannic acid to reduce gingivitis, and benzyl isothiocyanate, or BITC for short, which delivers a rapid, hide-killing antibacterial strike right as you chew.
What's really cool is that the physical act of chewing the Miswak is what triggers the immediate release of these chemicals. Because the twig has a slightly spicy, almost mustard-like hot taste, it triggers saliva production. That extra saliva acts as a natural buffer, immediately elevating the pH of your plaque and totally neutralizing the acidic conditions that actually cause tooth decay.
That brings us to Section 4, clinical and therapeutic benefits, lab results, and bacterial efficacy.
So we know the chemicals are in there, but clinical tests show that Miswak extract actively inhibits the growth of some notorious decay-causing pathogens. We're talking about heavy hitters here, like Streptococcus mutans, the main culprit behind cavities, Porphyromonas gingivalis, which drives severe periodontitis, plus oral fungi like Candida albicans, and even bacteria like Staphylococcus aureus.
And here's the hard scientific proof, right in the petri dish. It's pretty amazing. Randomized clinical trials show that this completely natural herbal extract significantly reduces Streptococcus mutans counts over time. In fact, it can stand toe-to-toe with standard fluoride toothpaste formulations when it comes to inhibiting bacterial growth.
Now, here is an absolute standout number from the clinical studies. 5. Researchers found that using a Miswak 5 times a day, which, if you remember, perfectly aligns with that Islamic prayer schedule we talked about earlier, produced a significant reduction in gingivitis compared to just doing conventional brushing twice a day alone. It is such a fascinating intersection of an ancient daily routine and modern clinical validation.
But the big takeaway here is that unlike some really harsh synthetic chemicals we use today, the Miswak is smart. It maintains oral biological equilibrium. It targets the bad, disease-causing bacteria while actually preserving the normal, helpful flora that your mouth needs to stay healthy, like Streptococcus viridans.
Let's wrap things up with Section 5, Miswak versus modern toothbrushes, a head-to-head comparison.
First up, let's look at the chemical formulations. In a clinical trial involving high caries risk patients, Miswak toothpaste and standard clinical-grade fluoride toothpaste were equally effective at killing cavity-causing bacteria over a 3-month period. Miswak leverages its natural BITC and resins to get the job done, though standard synthetic fluoride does still win out when it comes to delivering maximum enamel remineralization. Now, when we compare the actual physical tools themselves, the modern toothbrush definitely dominates when it comes to broad mechanical sweeping across all the surfaces of your teeth. But the Miswak excels at delivering that immediate chemical pH buffer and getting right into those interproximal spaces. In other words, it cleans brilliantly between the teeth, where normal bristles really struggle.
So the narrative here isn't actually a competition at all. It's a synthesis. Clinical studies conclude that plaque scores and gingival health improve significantly when the Miswak and the toothbrush are used together. The data proves these two tools are perfectly complementary.
Honestly, the real secret to optimal oral health, the ultimate oral hygiene hack, if you will, is combining the widespread mechanical brushing action of your morning and evening routine with the chemical pH buffering touch-ups of the Miswak throughout the day. It is literally the best of both worlds.
All right, let's summarize and see how all of this builds together. We've taken a deep dive into a tool historically rooted as far back as 3500 BC, strongly endorsed within Islamic traditions for daily purification by the Prophet Muhammad, and found it perfectly validated by 21st century clinical dentistry. The Salvadora persica releases a powerhouse of natural chemicals, including naturally occurring fluoride, silica, calcium, and BITC. It's scientifically validated to kill decay-causing bacteria, making it an incredibly powerful adjunct to our modern toothbrushes. It's absolutely incredible to think that a simple little twig holds such sophisticated chemistry. So, I'll leave you to ponder this final question. Is it finally time to upgrade your routine and bring a little 5,000-year-old ancient wisdom into your daily life? Thanks for exploring this topic with me, and keep learning.